and get started. And again, of course, Dr. Tedros, you know me, but for those of you who might not know who I am, I'm Lois Pace, I'm President and Executive Director of Global Health Council. Very happy to be joined by various co-hosts for this meeting who I'll ask to introduce themselves in just a minute. But again, we are co-hosting today's discussion with WACI Health, Action for Global Health, Results, and the Civil Society Engagement Mechanism for UHC. So very grateful to have brought this together in collaboration with those various groups. And of course, I'm very grateful to you, Dr. Tedros, for joining us today. I would be remiss if I didn't congratulate you on a successful virtual World Health Assembly last week, as well as your executive board meeting. I know that you're coming off of a very busy time, and we're incredibly grateful that you are spending today or part of your day with us. Of course, our objective for this meeting was largely to kick off what we hope will be a series of discussions between you or your leadership team and members of civil society or representatives of various communities who are quite eager to be supportive of WHO in this important time of need as we all respond to the COVID-19 crisis. You will hear today from a couple of our co-hosts who will want to present various recommendations or proposals for how we might want to move forward. But then we worked with the 130 or so attendees to call a number of questions that I know that you graciously offered to answer directly. So again, thank you for your time in doing so today and your candor in doing so today. I'll finish my remarks just by saying we have representation from over 30 countries and across the spectrum of global health priorities, whether that be in infectious diseases, maternal child health, nutrition, water and sanitation, and the like. So we were really hoping to bring a number of different people together at this time, but again, it's not the only conversation we hope to have, and certainly not only with this group of people. I will stop now and just ask that each of our co-hosts introduce themselves. I will start with Katie, who's at Action for Global Health, and then I'll move to Esther and finally Rosemary. So Katie, go ahead.
Hi, Lois. Hi, everyone. Many thanks to Lois for organising this event. Delighted to be co-hosting. My name is Katie Husselby. For those of you who don't know me, I'm the coordinator at the Action for Global Health Network, which is a network of more than 50 UK-based global health organisations. Huge thanks to Dr. Tedros for making time for today and to the team at WHO for organising this event too.
Thank you.
And my fellow co-hosts and guests, good afternoon. I'm Dr. Esther Njoroge Mureithi. I am the Regional Director for Smile Train in Africa. Smile Train is the world's largest cleft lip and palate charity. I am a member of CSEM Advisory Group. CSEM, which is Civil Society Engagement Mechanism, is the civil society constituency of UHC 2030. It is a membership organization and it raises a civil society voice to ensure that UHC policies are transparent and inclusive, and the voices of the marginalized communities and the vulnerable. Thank you for having me.
Thank you.
And finally, Rosemary, if you are on, it would be great to have you introduce yourself in WACI Health as well.
Thank you so much, Lois. My name is Rosemary Mboro with WACI Health. It's an Africa regional advocacy organization. We also host the Africa Civil Society Platform on Health in Africa. And we are currently also partnering with MSH to host the Civil Society Engagement Mechanism of UHC 2030. It's a pleasure to be here, and many thanks to all the civil society and community colleagues who are here this evening, afternoon, morning. Thank you.
Thank you. Thank you, everyone. It could be that we have Joanne Carter on as well, although we haven't seen her just yet, but I want to acknowledge Results was also a partner, and I know that you and Joanne go far back a ways, given your extensive work in this area with her. And so I know that she's sending her regards as well. So I think that is essentially our our introduction at this point in terms of the conversation we wanted to have. We wanted to be sure that you knew that we all and our various partners were available as a resource for you. I think now we would like to actually hear from Esther their ideas or proposals for how we might want to work jointly. And then from there, hear your reactions to those recommendations as well as have an open conversation with the community. So with that, Dragana, it would be great to pull up the slides, and then I will pass the floor to Esther.
Overview of COVID-19 response principles and social participation recommendations. I will be looking at two studies that were carried out by CSCM and the WHO's Social Participation Technical Network, and also look at two papers that have made recommendations on how civil society should be involved in the COVID-19. COVID-19 has turned our world upside down and has revealed the very ugly underbelly that is our very fragile health systems that are ill prepared to handle a pandemic while continuing essential health services, especially in the global south. And alongside the COVID-19 pandemic, there is another looming crisis, one of financial instability at the household level, pushing households further into poverty, rising sexual and gender violence, instances of human rights infringement, possibly a neglect on chronic conditions, on the continuum of care of chronic conditions, and most definitely, there is a cessation of essential surgeries, part of which is cleft lip and palate treatment. How is civil society involved in this response? In the study conducted by CSCM and Social Participation Technical Network, more than 70% of the respondents, who are over 200 from 58 different countries, were not substantially involved by their governments in the COVID-19 task forces. And of the 16 who are involved, they had a representation on the technical network, on the technical teams. Of the 70%, even though they were not involved by the government, they were involved in their own capacities in some space through communication, continuum of care, advocacy messaging, as well as providing resources, especially for households that were affected economically. Next, please. Next. And the second article, which was published on the BMJ Global Health, looked at the governance of the COVID-19 response. And it sought to answer two questions. One, how are decisions being made, decisions that are affecting each one of us, regardless of whether we are affected by COVID-19 or not? And the second question was how far policymakers and politicians were consulting people who had experience and expertise on the secondary effects of the COVID-19 measures, which included lockdowns, social isolation, and movement restrictions. And a few interesting points came out of that study. That one, not all countries made their task forces public, and those that did make them public, there was a predominance of politicians and ministries of health officials, virologists, and epidemiologists. There was a glaring lack of experts on issues that had nothing to do with COVID-19, health, social, and societal consequences. There was little transparency, and not surprising, female representation was very minimal and civil society was hardly involved. And this paper concluded that one, there needs to be sector-wide consultation on the COVID-19 response measures. And two, there needs to be more transparency regarding who is being consulted by the decision makers. Next, please. And based of these two studies, as well as other papers that exists, including the civil society, the UHC 2030 key asks at the high-level meeting last year, as well as the civil society priority asks political declaration that our president signed committing for health for all, the World Health Assembly COVID-19 resolution, UHC 2030 COVID-19 statement from the co-chairs, the civil society, as represented by CSCM, has put together calls to action. And these are draft calls to action that were released this morning. They're very fresh, that will evolve as more wider consultation is carried out. They're based on 4 key pillars. One, leave no one behind, which means that those who are farthest left behind should be considered first in the COVID-19 response. Increase public health financing and financial protection, that our health systems should be resilient and strong enough to protect the vulnerable communities and to protect society from financial catastrophe as a result of COVID-19, as well as health expenditure. 3, to focus on health workers. WHO has estimated that by 2030, we will have a shortfall of about 18 million health workers across all cadres. And therefore, there is an urgency for governments to invest in health workers, to train more, to employ more, to provide conducive working environments, and to protect the health workers, both their physical well-being through, in this crisis, the personal protective equipment, as well as protecting their mental and social well-being. And lastly, to engage civil society communities in the decision-making and in policy formulation as well as implementation. And the second resource that is available for civil society is a toolkit, which is a living document, and this was published by the COVID-19 Advocacy Coordination Hub. It is a set of 8 principles that lay out the key issues to be taken into account as governments and other decision makers respond to and rebuild from COVID-19. The principles, next please. The principles are people first, protect human rights, universal, the actions and the decisions need to be universal, that all people should be able to access all the resources that they need, even during the crisis. It should be proportionate, that the measures being put in place are targeted at COVID-19 mitigation, but should not cross over beyond areas that do not concern the virus. There should be accountability. Measures should be global, while response is country-based. COVID-19 pandemic is a global issue, and as long as one of us is at risk of COVID-19, the entire world is affected. There should be future forecasts. While the measures we are seeing are short-term and aimed at flattening the curve, there should also be medium and long-term measures that strengthen and build a resilient health system that is able to take care of the health needs of its population. And finally, the measures being put in place should do no harm first. Now, these are 2 tools that I've highlighted that are available to civil society and are suggestions on how civil society can engage in the COVID-19 response. They are available on the cscmonline.net, as well as on the Sherpa, that is SHERPA. There are examples of the resources out there, but I know there are many more resources. Next, please. And so to conclude this very brief and fast talk, I pose 3 questions for you, DG. 1, how should governments include civil society and communities in the COVID-19 response at the national level? And 2, what will WHO and other partners at the global level do to ensure that civil society and in particular, the voice of the most marginalized are included. And third, at the global level, what is WHO doing to ensure that civil society is included in its decision-making and in the resources that are being put together for COVID-19 response? For example, the Access to COVID-19 Tools Accelerator, which aims to accelerate the development, production, and equitable global access to COVID-19 resources. Next, please. And thank you. Those are our contacts for CSCM. And Dr. Tedros, thank you for taking time to be with us on this town.
Thank you.
Well, Dr. Tedros, I think this is the time that after Dr. Ndorere, we wanted to turn things over to you and respond to some of the questions that she posed and even some of the recommendations that she presented on behalf of the civil society engagement mechanism and other members of civil society. So if you wouldn't mind, we'd love to hear from you. Thank you.
You know, Ori, first of all, thank you, Lois. Thank you for bringing us all together. And I would also like to thank Katie, Esther, Rosemary, and Joan, and all your colleagues there, and all participants, of course. So why not I start by introducing you who is with me today. We are in one of our meeting rooms, Sal D. So I hope you know me, but I will introduce myself. So you don't get to be formal. My name is Tedros, so please drop the what they call it, the title. So that's how I would like to introduce. So Tedros, and please, I want my colleagues actually to introduce themselves. So we have Nono next, please.
Yes. Good afternoon, good morning, colleagues. My name is Nono Simelela. I advise the DG, not Tedros, the DG. Thank you.
Good afternoon. Thank you very much indeed for the presentation. My name is Oliver Morgan. I work in the Health Emergencies Program here at WHO. Thank
you. My name is Alexandra Kuzmanovic, and I'm a social media officer in the headquarters.
Hi, Lois. How are you? My name is Shanaz. We've worked together arranging for this meeting. I am the director in the Office of the Director General.
Hello, Lois and colleagues. Peter Singer. I'm a special advisor to Dr. Tedros and work on SDG Gap, where there's a civil society accelerator that we hope we can leverage to take your ideas from this meeting across the various multilateral organizations. Thank you.
Hello, my name is Paul Garwood, and I work in the Department of Communications as well, and we work closely with all our regional offices and country offices, and as well as a range of organizations who we, let's say, can work with on an influencer type of basis as well.
Yes, hello everybody, good afternoon or good morning for you. My name is Tainan Acharya. I work in the Department of Health and Multilateral Partnerships, where my task is to support WHO's collaboration with NGOs and civil society. Thank you.
Good morning, good afternoon. I'm Gavin Silversmith. I'm the director of the Department on Health and Multilateral Partnership, coordinating on NGO engagement, private sector, parliamentarian, and multilaterals.
Thank you. So we have, I think, 2 colleagues online. if you would like to introduce yourselves. No? Rene. Okay.
I think that Andy Seal is online from WHO, but he's unable to mute himself because he's lost in attendee land. But I know that he sends his regards.
Okay, thank you. Thank you very much.
Was active in the global action plan process that Peter Singer mentioned as well.
Yeah, thank you. So again, thank you so much for this opportunity. I had actually a speech prepared, and from your presentation, you made my speech boring. Yeah, that's why I like working with civil society. To the point, you know, issues that you want to say in very concrete terms. So I will follow your lead, and I will comment on your proposal. Express my opinion on that. And also there were 4 things we proposed as requests from you. So instead of reading my speech, I will just focus on the 4 issues plus the issues you raised. I would like to start from your proposal actually. The 4 areas you have said, first of all, before that, I would be happy to start actually from the problem. From the study, the survey you already showed us, the involvement of civil society is actually nowhere to be seen. So those countries who have involved like moderately or substantially are only 31%. So 40% not at all and 30% minor, meaning 70% nothing. And that is really a real problem. So addressing that, as you rightly said, is going to be very, very important. And the questions you asked are related to that. So I will come back to that later. Then the second part I would like to comment on is on your on the other problems you raised, especially you know, the predominance of politicians or virologists, epidemiologists, and no female representation, transparency is really little, and the challenges that you have already outlined. And we need to really address those, and I would like to thank you for bringing those results actually from the publication of BMJ, and understanding this really, really helps, because from the start, WHO has been saying this response will not be successful without the involvement of communities. Actually, not even involvement, ownership by the communities. It's when communities own the response that it could be successful. And countries who have succeeded, one thing they have done is clear communication with their communities, empowering the community and involving the community, and making sure that the community is taking its share. The way when they do that, the result is better, and that's the reason why we were pushing for community participation and ownership as one of the recommendations to countries. I think based on this study, going into details and as reminding countries the specific problems will be very, very important. It cannot be just portrayed as or presented only as involved civil society and community. We have to show where the problems are, and those problems should be fixed in order to make sure that the participation is complete. So I'm agreeing with the problems that you have already outlined. And then to call to action, Again, I take all of them and I add my voice to your 4 key pillars, and I fully agree. Leave no one behind, increase public health financing and financial protection, because this is about lives and livelihoods, as you rightly said. Focus on health workers, engage civil society and communities are very, very important. And we agree fully. The only thing maybe is, do we really need to increase public health financing and financial protection? Maybe having the financing of the public health separate, and then the financial protection, which is related to livelihoods, maybe separate, could make it really clear. I know how, many actually, especially families in developing countries, lead their life. They get their daily bread actually from their daily labor, and protection of those very vulnerable communities is very, very important. So the livelihood part, of course, some countries are doing their best, some innovative ideas to help them, but still, I don't think it's enough. And the impact of this COVID on the economy will really affect many families, their livelihoods, which in turn could affect their health. So because of health, their livelihood is affected. And then when their livelihood is affected, back again. So this is like getting into a vicious cycle of poverty and lack of health, or feeding each other. So maybe that's the only thing. Otherwise, we can still keep it as 4, but probably taking out the financial, the livelihood, in putting it in its own would be, I don't know, more shows some strong strengths in our recommendation. Then I had, as I told you in my speech, I had 4 requests, and they're very similar, some of them. So the first one was to continue to advocate for increased investment and resources for pandemic preparedness, and that could be under the public health anyway. And second, work to protect vulnerable groups, including refugees, people who are detained, and those in nursing homes. You have it already, leave no one behind. So the 2 are the same. Then our third recommendation was fight infodemics and help people get reliable information, because we cannot overcome this crisis without community trust and solidarity. So this was the third recommendation. And number 4 was our focus on advocating for universal health coverage. Now, more than ever, actually, we should unite on advocating for health for all. We have the WACI political declaration from last year, and we have the resolution from parliamentarians, from speakers, the Internal Parliamentary Union, when they met in Belgrade, Serbia, last year again. So we have already the political commitment, and we have seen how countries' economies actually lost billions, and now hundreds of billions, of course. And imagine a small part of that would have helped to build this system many years ago, and we could have averted the loss of all this life, more important life, but also the money we lost. Just a fraction of the money we lost. Many countries lost a lot of money. By the way, that should come forward. And it's the right thing to do, the smartest thing to do. That's why we always say in WHO, health is central. Invest in health, then it will have a positive impact in development, in even peace, and the rest. It's healthy society that can bring development, and the development brings peace, stability, and so on, the rest. So the fourth one is the UHC and showing the centrality of health. You know, people talk about other things, even economy. Without health, we have seen it now. It's gone. If you ask the only thing as an individual, as an individual person, you ask to be healthy. And now, as a nation, health, I think now each nation will ask to be healthy first. That's it. Nothing really is more important than health. Nothing. And we have learned it the hard way, which is really bad. But can we really learn our lessons from here? This is where we unite. We should unite. Then coming back to your questions, we have already been working together on the document we prepared on how WHO and civil society can work together, and together really making sure that these recommendations, by the way, they're the same almost. How do we make them happen is the question. And then your question is very important. I will close with that. One, let's reactivate that partnership we started, and let's meet on regular basis. It could be every 2 weeks we can have a webinar. And then once we have that global platform, then agree using that global platform what to do at all levels, and most importantly at country level. And then through that process, increase the involvement of the civil society and address the problems that you have already found from your assessments. Lack of participation. To be honest, 30% is not participation. 30% of countries, they're saying moderate and whatever. Let's consider that it doesn't exist. So there is no participation. That's how I see it. So let's agree on our next meeting. The representatives, and then from our side also can represent WHO. We could be 4 or 5. From your side, it could be 5 or 10, whatever. Then we have this regular webinar. But before that, between now and the next meeting, we can prepare some of the things we need to do. And during the next meeting, we can endorse those and move on. So I'm reversing it. So let's start from number 3, meaning let's start with what we can, meaning the global level participation. And I would like to say sorry, actually, that we should have done this before, and I will take that personally. We should have engaged you, and that's a failure, I can admit. Then let's fix that first. Let's meet regularly. Let's ensure your global presence, and then fix the next levels which you have already indicated. We can do it together, and then through that global process, actually participation, we can involve also our countries, our country offices, our regional offices. We can bring them along to discuss during these regular meetings, and then through that mechanism decide on what to do. So from our side, we will assign, of course, we have Gaudens who is in charge, but we can discuss later and have a focal who can be involved in the discussion between now and our meeting in 2 weeks from now to agree on concrete issues, and then move regularly. By the way, we have a group of experts that we started. When did we start? In February? We meet every week, actually. These are experts from all over the world. And they gave us the best advice, because we have experts from inside, but having, experts involved with us, work with us and help us in the thinking process, in the decisions, is really helpful. And the role of the civil society in this respect is really big. And there is a big stake now coming. As you know, we have launched the ACT Accelerator, especially the initial discussion was focused on vaccines, and then started to expand to include therapeutics and diagnostics and later health systems. To be honest, going forward, it will focus on vaccines and therapeutics. And the reason for the launching of the ACT Accelerator is the two objectives. One, to speed up development, and two, to ensure equitable distribution, access to those who need it. And as you have heard many leaders saying, making, for instance, a product, if it's a vaccine, a global public good, making it a global public good. So your role, especially in this, will be very, very important. So especially for the ACT Accelerator, it's not late. For the other things, I told you, your involvement, earlier involvement could have been helpful if we had a mechanism like what we're proposing today. So I will stop there, but I'm very, very grateful for this. I think going forward, we should really work together and make sure that this response becomes more effective with the participation and ownership of the communities, and no one actually true representative than the civil society of the communities to mobilize the communities. So I close there. Back to you. Thank you so much for changing the format. So you helped me to stop reading. I prefer to just say something instead of okay.
Yeah, we know you well enough to know that you maybe much to the dismay of your colleagues that you like to go off script, and so I'm happy to facilitate that for you. But no, thank you very much, Tedros. It's going to take me a very long time to become accustomed to only calling you Tedros. But I know that it's refreshing to hear your commitment to an ongoing dialogue. We appreciate the beginning of a proposal you just put forth. We would love to match some of the other dialogues that you've had with other stakeholders. And so thank you for that. Thank you also for just embracing the recommendations that Esther offered so readily. I think already we're off to a good start. We wanted to be sure, though, to leave some time for questions that we have received or still receiving from people in the community. Again, we're joined by over 100 stakeholders from across the spectrum who are all listening intently to your remarks, and I want to be sure their voices are heard in some capacity. So I will go ahead and pass things over to Katie, whom we met earlier, to help lead us through some brief Q&A based on some outstanding questions that people might still have. And again, with thanks and regards for you and your time. Katie?
Thanks, Lois. And yeah, many thanks to you, Tedros, for those remarks and also providing this opportunity for Q&A. Just to echo what Lois said, it's great to hear you recognizing the unique role of civil society and communities in the COVID response. And as a member of the advisory group on the UHC 2030 CSEM, also great to hear you welcoming those 4 pillars and the key asks that they've developed. In terms of the setup for this Q&A, a number of participants have shared questions in advance of this meeting whilst they've registered for this webinar, and there's also a Q&A box in the bottom right-hand corner. If people would like to add additional questions there, it's separate from the chat box, but Q&A bottom right-hand side. It'd be great if when people are adding questions, they could add their name, their organisation, and where they're based. like I said, we've had questions sent over in advance, and I've been ticking off some of those questions in terms of civil society engagement whilst you've been going off script, Tedros, and making those opening remarks. And it's great to have answers already to some of those questions that have been sent in advance. I wondered if I could pick up on a couple of pieces and just ask for some further reflections from you in terms of civil society engagement. I might kick things off with two questions, if that's okay. Firstly, great to hear you recognising sort of the results from the article in BMJ of sort of the lack of civil society participation. I'd just like to pick up a question from Eliana, who coordinates the CSEM and was involved in that work, around sort of what advice would you give to civil society who are eager to collaborate with governments on the COVID response, but haven't been given the opportunity so far? And secondly, just in terms of recognising that civil society health advocates, I think David Barr has put a question in the Q&A box, sort of need resources to also carry out this essential role advocating to governments on health. And just whether you could say anything about how WHO can facilitate or help to facilitate resource mobilization for health advocacy, not just for the COVID response, but of course, as you were saying, for UHC more broadly. Thank you.
So do we, shall we continue with this too? Yeah.
Sorry.
Katie, you want me to proceed with that too?
Yes, please.
Okay. So on advice to governments, we have a platform, and the next one is this week, actually Thursday, after tomorrow. We have started some weeks ago, not actually weeks, maybe a couple of months ago already, having a weekly mission briefing. It was in February, I think. And initially was to brief the missions in Geneva, the ambassadors and health attaches here. But then we upgraded it, and we now have this weekly meeting that ministers attend. And in a good number of the sessions we had, ministers shared their experience on the fight against COVID. So we can raise this issue during that briefing. And we can ask the question for them to answer. By the way, it's two-way communication. They ask questions and we ask questions too. So we can ask them and we can at the same time recommend. That's one way of doing it. Since this is high level, the ambassadors are here and the ministers also get involved. That would be a good platform. The other thing would be we need to pull the experience of some countries and share it with all countries, what some countries are doing in terms of involving the civil society and how that is actually helping in the fight. Many countries respond to that kind of experience. When other countries have done this or that, then there is highly likely that there is interest and wanting to do it. So we can do that too. The third is we regularly communicate. We send them letters, by the way. It's during this COVID, I have written to many leaders and ministers and so on, more than any time before. So it's becoming a record, actually, of a DG writing letters to many people in a short period. And also more than 50 conferences, actually, press conferences, more than 50 in just 3 months. I think that's already a record. So we can continue sending them letters, even if we have the record. And that's another option. So the first question is very important. So we will come back to you with more ideas. And when we meet in 2 weeks, between now and 2 weeks, of course, your colleagues and our colleagues will meet and identify practical solutions. But this is just off the, whatever I think can work. But when our colleagues sit down, they can have even better ideas than what I'm throwing now. So we can pull all this and make sure that governments really take it seriously and involve civil society, involve communities, because it will not be successful without that. Second, on resources, we can help you in mobilizing resources. The other part, though, is Solidarity Fund, which we raised around $214 million US. With your support, of course, you were involved in that. And now we're ready. We have been working on WHO Foundation for the last 2 years. We hope to launch that soon. And resources that are mobilized through the WHO Foundation, up to 30% of it goes to partners, mainly civil society and so on. So there will be opportunity, hopefully soon, that we can share with you or through the foundation some funding also for civil society use. And even now, from the resources we have, we will encourage others to help civil society. But for some very critical activities you need, even sharing from whatever funding we're mobilizing is still an option. Thank you.
Brilliant. Many thanks for those responses and for the practical ways moving forward. I wonder if I might ask a couple of follow-up questions. You also mentioned the ACT Accelerator and the development of COVID vaccines and health technologies, which are absolutely crucial. A couple of different civil society organizations have written in on this theme, but a couple of the key questions, it would be great to get your thoughts on how we can ensure that civil society representatives are included in the ACT Accelerator facilitation group and in each of the pillars. Apologies, I'll pause there and just leave that as one question. Thank you, Tedros.
Yeah, thank you. So on the ACT Accelerator, we believe that you should be involved. And there are some proposals, and one of which is not in each pillar, but in the, what do you call it? There is the hub, and to have on one side a group, the donors group supporting, on the other side, a civil society involved in advising and supporting the effort. It's not yet finalized, but wherever it is, I think your involvement from the start will help. So although I say something specific, saying, okay, on one wing of the hub as advisory, but that, we may have even a different and better option. So we will get back to you and discuss with you the various options there are. But the only thing I want to really make sure is your involvement is very important, wherever you will be in the structure or so.
Brilliant, thank you. And looking forward to continuing those discussions and really welcome that commitment from you. I also wanted to pick up, we've been discussing civil society and communities and conscious that we had a number of questions both in the chat box and in advance about the role of youth in the COVID response. So both heard from Alois Arasa, who's a youth leader for health for WACI Health based in Tanzania, and Genevieve from Restless Development is also on the call and has written a question about the role of how WHO is working with young leaders, both in terms of the COVID response, but also towards UHC and health advocacy more broadly. It would be great to get your thoughts on the role of youth.
Okay, thank you. This this COVID has been with us now for 4 months, So I will throw the ball back to our colleagues there. From what they have seen so far, how do they think they would like to be involved as youth? Where do they see they can really make a difference? And where would you like to be involved? What role do you want to take? Then I will also say my 2 cents, if they're online.
Unfortunately, I think the attendees are muted, so won't be able to speak back. But I think an important challenge for us to go away and come back to you with further thoughts as well. If I might shift.
That would be good. Something from then I will share with you some youth I met where we were discussing about the gaps many countries had, including in developed countries, by the way, is the lack of workforce that works in the public health part. Like, for instance, we say testing, contact tracing, and isolating, and so on. So in one of these, for instance, if you take contact tracing, no workforce to do the contact tracing. And some countries immediately trained some people and deployed. The surge of workforce. You don't need to be a nurse to do the contact tracing, or you don't need to be a health professional. With some training and orientation, you can do that. And for this virus to be defeated, you remember what we have been advocating from the start. Testing is important, and many people still actually teasing me saying test, 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 which we said then 3 times because the testing is important. But the testing, of course, you will need professionals, considering the kits we have now. But the tracing, anyone can do it. And this youth told me, said, they can be deployed, they can help, especially in countries where resources are limited and the government cannot really pay salaries and so on. But how can mobilizing volunteers? And we can volunteer. That's what they said. With some training, we can volunteer to trace. So this is one. Of course, there should be remuneration because some youth, they cannot do the work without support. But that can be considered, some remuneration, and those who have other income sources can volunteer, and the youth can be involved actually in the response itself with just little orientation. And the youth can do this without any problem. But anyway, since we have agreed to discuss in 2 weeks from now, sending out this message to countries, to the youth, on how they would like to be involved, how they would like to contribute, will be very, very important, actually. I'm just bringing one example where I heard youth group suggesting that they could be involved in contact tracing and other parts of the public health where there is shortage of workforce. Thank you.
Many thanks, and I will definitely take that call away and come back and pick up this discussion again in 2 weeks. And really, thanks again for making that commitment. I'm conscious that time is running out, so I wonder if I might just finish up with one final question, Tedros, about obviously moving beyond, as you recognised in your remarks, sort of the health impact of COVID to the sort of the human rights implications as well. And we've had a couple of questions, particularly picking up from Ravi and Sundar from the People's Health Movement about a question around the extent to which WHO is aware that the governments are making use of this health crisis to crack down on civil liberties and people's rights, narrowing democratic space and social movements for educating, organising and mobilising people. And it would be great to get your thoughts about what WHO can do in this regard. Thank you.
So Thank you so much. We actually had one op-ed on that covers this area, and we also have raised it in some of our pressers. I think talking about it regularly is very, very important. And we have to remind the world that the COVID can be defeated actually with democracy, not without it. Because we have already said that it's the empowerment of communities, it's the involvement of communities, it's the empowerment of civil society and involvement of civil society that will help in defeating this COVID. And if that's what we believe, then that's it. We cannot stifle human rights to really get rid of the pandemics. It will actually aggravate it. It will even delay the fight. So there are many ways that we can raise our voices. We can do that. We will continue to do that. And your voice, together with our voice, can even be more powerful. And one possibility would be when you're ready, we have these regular pressers. We can involve you in some of our pressers to come and speak about it and raise your voice. One thing that really people are appreciating about the regular presser we have is we're inviting others to join and speak in their areas in their mandate, especially where they have a comparative advantage. And we did IMF, we did Gavi, we did UNICEF, we did what else? The International Olympic Committee. We did FIFA. We did. We bring many. We did leaders also, like the president of Costa Rica, I think recently. So we invite people to join. So one would be we had this with Madame Bachelet already at the start. And she didn't join in the presser, but we had something on human rights with her. We can invite her. So when we invite her, there could be a civil society also who can be represented to speak. So President Bachelet, the head of the Human Rights, the Commission, and then civil society representative could help in increasing awareness and making sure that it's actually safeguarding human rights that can help us to defeat this pandemic. And this could be one of the agenda we can discuss next week. Thank you for asking that question. I can talk to Madame Bachelet, and then you can also prepare from your side to have the representative to speak in one of our pressers, one of the pressers anytime when we're ready.
Thank you. Really welcome that opportunity. I will definitely we'll go in and follow up on that front. Huge thanks to you, Tedros, for making the time today, for renewing your commitment, and looking forward to this being the start of a longer conversation and further follow-up conversations in the coming weeks with civil society and communities. I'm conscious that we're slightly overrunning, so I'm going to pass over directly to Rosemarie, who's going to give some closing remarks. Thank you again.
Thank you very much. Thank you. Thank you, Katie, and thank you, Tedros. Thank you, civil society and community colleagues. My role is to move a vote of thanks. So, Dr. Tedros, in Africa, when we thank elders, especially elders of significant positions in society or pillars in society, we use African sayings and African proverbs. The one that comes to mind right now is that a cooking pot sits on 3 stones. We want to thank you because relating that to global health, one of the cooking stones is definitely the people stone. It is the community stone. It is the civil society stone. Thank you for recognizing that in your remarks as you are saying that, or acknowledging that civil society and communities have not been adequately involved in the process so far, whether at the global level, regional or national level. We thank you for that recognition. And even for recognizing that no response, including the COVID-19 response, will be successful without communities. As colleagues here this afternoon, evening or morning have shared with you concerns around civil society and community participation, concerns around how this one stone of the people actually is weak. You have shared with us openness in terms of proposal for frequent meetings and engagement, etc., etc. You have mentioned many things in response to our comments. That has sparked a lot more questions, actually. There are so many more questions that we'd like to engage you on, like the Solidarity Fund, how will that be governed? How will that look like? So many things that have actually come up. You've mentioned about civil society participation at the country level and how WHO is open to civil society consultations, but we know that those processes am I still on?
Yes.
How those processes are country driven. So in future conversations, we would like more conversations on how can civil society engage at the country. We make that happen. Thank you for highlighting that as we look forward to ensuring that people, communities and colleagues who are experiencing issues, gender-based violence, communities who cannot access services because they are criminalized, and so on and so forth, that actually what we are doing as a global community translates into saving. I want to thank you very much and to thank our colleagues who joined this afternoon. So quickly handing back to Lois for the closing. Thank you very much.
Thank you, Rosemary, and also my regards to Katie and Esther as well. Fabulous women in global health who helped deliver our sort of recommendations to you today. Again, acknowledgement as well to Joanne, who has joined us from Results as a co-host, and all of the attendees who stayed on. And I think, Dr. Tedros, you should be aware that people were enthusiastic about all that you shared and all that you committed today. So I think that's all we need to say, recognizing that we have taken an hour of your time. We're grateful for that, and we're hopeful about future dialogues with you.
Just a big thank also from our side, and reassured we follow up this week already.
So already rolling. So thank you so much. No, look forward actually to meet you virtually again in 2 weeks. Then we have to keep it regular, and hope also to prepare between now and then, and have act on what we have agreed today. She was reminding me, Rosemary, she had this earring Africa map. So is it because it's Africa Day yesterday you have that? So happy Africa Day. Asante sana.
Asante.
Asanteni. So thank you so much. And thank you for today. I hope we have made some progress, and look forward to talking to you again in 2 weeks. And thank you so much indeed. And thank you.
Sounds good. Thank you, everyone.
Thank you.
Have wonderful evenings and days wherever you are in the world.
Thank you. Thank you.